Okay, imagine this. A massive bill gets signed into law. Huge promises, right? Tax cuts, a stronger safety net.
Yeah, sounds good on the surface.
But at the same time, it kicks off this really intense debate, especially about how it might affect millions of Americans.
And that's what we're diving into today, this one big, beautiful bill act.
Exactly. We're focusing specifically on the proposed changes to Medicaid. There's just so much swirling around public opinion, what politicians promised, and what the real-world consequences might actually be.
And we'll be unpacking all that using a whole stack of sources. We've got analyses from conservative think tanks. We've got stuff from hospital associations.
Major news outlets, public polls.
So even looking at what people are saying on social media, it's a real mix of perspectives.
Yeah, so our mission here is basically to help you cut through all that noise. We want to lay out the different arguments.
Understand how these polls sometimes give conflicting results.
Right. Grasp the methodologies behind that and really explore what these changes could mean for you and just for the future of healthcare in the U.S. Okay, let's get started.
Let's do it.
So this one big, beautiful bill act, H.R. 1, it was signed into law just last week.
Right. It passed the House and then just barely got through the Senate.
Yeah, Vice President J.D. Vance had to cast the tie-breaking vote.
And the main goal, officially, is to extend those 2018 tax cuts.
But the way it passed is important, right, through reconciliation.
Exactly. That's key. It's like a budget fast track, lets things pass the Senate with just a simple majority, no filibuster.
Okay, and the initial House Republican instructions for this reconciliation, they involve some big numbers for health spending.
Huge numbers. We're talking an estimated $880 billion in cuts from the Department of Health and Human Services budget over 10 years.
$880 billion. Wow.
Yeah, and many analyses, many sources are suggesting that hitting a number that big is, well, virtually impossible without making sharp cuts to Medicaid specifically.
Okay, so that's one side, but then you've got this this contrast, right? The White House spokesperson comes out.
Right, and says President Trump made a clear pledge, remember, no cuts to Medicaid, Medicare, or Social Security.
So what are they saying the bill does to Medicaid then?
They frame it as tackling waste, fraud, and abuse, using common sense reforms like work requirements, eligibility checks, things they say are popular.
And Republican leaders are sort of echoing that.
Pretty much. Speaker Mike Johnson says these GOP reforms are meant to strengthen, sustain, and secure Medicaid, again, by rooting out waste, fraud, and abuse, making it more efficient.
And Congressman Don Bacon.
He talks about reasonable actions, things like work requirements for able-bodied adults without kids, auditing the Medicaid rolls.
But not, he emphasizes, cutting Medicaid for people who really need it, or for hospitals.
You're right. So officially, the only people they say are directly impacted are these able-bodied adults without young children at home.
Through things like needing to work or train or volunteer for maybe 20 hours a week to stay eligible for welfare programs.
But then you get the critics, and their view is, well, completely different.
Yeah, Democrats like Alexandria Ocasio-Cortez, House Leader Hakeem Jeffries, they're using strong language.
Very strong. Calling it a heist on Medicaid, some of the most extreme cuts to healthcare ever.
And they're pointing to specific projections, aren't they? Like from the CBO.
Yes, the Congressional Budget Office, nonpartisan group, they estimated that up to 11.8 million people could lose insurance over the next decade.
11.8 million.
And they linked that to about $1 trillion in Medicaid cuts projected within the bill itself.
That's a massive number of people potentially affected.
And it gets even more sobering when you look at other research. There's a new study, Harvard Medical School and CUNY Hunter College.
What do they find?
They predict this bill could actually lead to an increase in annual deaths in the U.S. by more than 16,500.
Whoa. Deaths.
Well, their logic is based on coverage loss. They estimate 7.6 million more uninsured people, almost 2 million losing access to a regular doctor, hundreds of thousands of women missing mammograms.
And the connection is that losing coverage means people skip care.
Exactly. They warn that people forego critical care, even avoid the ER because they're scared of the bills, and that, they stress, can be deadly. Their point is simple. Modern medical care saves lives.
That's a really stark projection of human cost. And it's not just individuals, right? What about institutions like hospitals?
Right. The American Hospital Association, the AHA, did its own analysis. They focused on rural hospitals.
And the picture there isn't good either.
Not according to them. They predict a $50.4 billion reduction in federal Medicaid money going to rural hospitals over 10 years.
50 billion. That's huge for rural healthcare.
It is, and they also estimate 1.8 million people in rural communities could lose Medicaid coverage by 2034.
So what does that mean practically?
Well, the AHA president, Rick Pollack, warns it could force those rural hospitals to cut services, lay off staff, maybe even close down entirely.
Leaving people having to travel much further for care. Even emergency care.
Exactly, hours potentially. And critics connect this back to the bigger financial picture. They argue these aren't really savings.
What do they mean?
They call it a cost shift. The argument is that the federal government stops paying, but the costs don't just disappear.
They get pushed onto who?
States, counties, tribes, healthcare providers, and ultimately individuals themselves. They'll have to bear the expensive care that's no longer covered. It really raises that question, doesn't it? Who ends up paying?
It absolutely does. Okay, so those are the projected impacts, the arguments back and forth. But what does the public think? How does this square with, actual voters?
Public opinion. This is where it gets really fascinating and honestly kind of contradictory depending on how you look at it.
Okay, so let's start with polls showing opposition. There was one by Fabrizio Ward.
Yes, for the Modern Medicaid Alliance, they found what they called an overwhelming majority of voters. 70% overall opposed the idea of cutting Medicaid spending to pay for tax cuts.
15%, that's a big number.
It is. And by a 50-point margin, what's really interesting is who that includes. It's not just Democrats. No. 51% of Trump voters opposed it in that poll, and 67% of swing voters.
Wow, okay. So opposition even within the president's own base, according to that poll.
Right, and it got specific, too. They asked about cuts affecting vulnerable groups.
Like kids, seniors.
Exactly. Strong opposition there, too. 71% against cuts to CHIP, the Children's Health Insurance Program, including 54% of Trump voters.
Yeah.
Similar numbers against cutting long-term care for seniors, help for low-income seniors with Medicare premiums, even maternal care for low-income moms.
It seems like the specific programs are quite popular, even across party lines.
Very much so.
Yeah.
And Medicaid overall, actually. That same poll found 3 out of 4 voters view Medicaid favorably. That includes 61% of Trump voters and 72% of swing voters.
And there's a personal connection for many people.
A huge one. Almost half of all voters said they have a personal or family connection to Medicaid.
Get this. About 1 in 5 Trump voters, according to the poll, are currently on Medicaid or have been in the past.
Yeah, and another 1 in 5 have family members connected to it, which really underlines that point Steve Bannon made.
Oh, is that?
He warned, a lot of Maggie is on Medicaid. If you don't think so, you are dead wrong. You just can't take a meat axe to it. And the numbers bear that out. Over 20 million Republicans are on Medicaid.
Okay, so that poll paints a picture of broad opposition, even among Republicans and Trump voters, especially when cuts are linked to tax cuts or specific programs.
Exactly. But, and this is a big but, not everyone agrees with how that poll was conducted or what it really means.
The methodology question. Who's questioning it?
The Center for Excellence in Polling, or CEP, it's a project of the Foundation for Government Accountability, which is a conservative think tank.
And what's their critique?
They argue the Fabrizio Ward poll's wording and question order might have biased the results, skewed them.
How so?
Well, for example, explicitly linking the cuts to tax cuts. CEP suggests that the frames it negatively from the start, or asking about cuts to specific popular programs like CDP, which CEP claims aren't actually targeted by the current proposals.
So suggesting hypothetical cuts that aren't on the table.
Potentially. And also the order of questions, starting with asking about personal connections to Medicaid or the importance of universal health insurance. CEP argues that could prime people, make them think more favorably about the program before they're asked about cuts.
Basically, the way you ask the question can shape the answer you get.
Precisely. And CEP did their own poll to demonstrate this.
Okay, what do they do differently?
They defined the reconciliation bill more broadly, just as advancing Trump administration's priorities for tax cuts and reducing federal spending, less specific linkage.
And what result did they get with that framing?
Quite different. They found 51% overall support for a bill framed that way, and among Republicans, 75% support.
75%. That's a huge swing from the other poll.
Massive. And they also asked specifically about work requirements.
The policy the White House and GOP leaders are highlighting.
Right. Asking about requiring able-bodied adults with no young children at home to work, train, or volunteer for at least 20 hours per week.
And the support for that.
Very high among Republicans and Trump voters. Over 70% supported that idea.
So it really underscores that point, doesn't it? Frame it as cuts for tax cuts, you get opposition. Frame it as reducing spending or work requirements, you get support, especially from Republicans.
It's all about the messaging. It's a classic example of how polling can be complex.
Definitely. Now, what about those crucial swing voters? We saw they opposed cuts in the Fritz Award poll, but what else do we know? Is there other data?
Yeah, there was an interesting analysis by Impact Social. They looked at social media discussions among swing voters.
Okay, what did that turn up?
It was pretty mixed, actually. About 22% were clearly against the Medicaid cuts in their online conversations. 15% were supportive.
And the rest? The majority.
A big chunk, 63%, were neutral or didn't express a strong opinion either way.
Interesting. But among those who did have an opinion, what were the themes?
Well, among those against the cuts, something really stood out. Nearly 4 in 10 of them specifically mentioned President Trump's old promises.
The no cuts pledge.
Exactly. The report said these voters felt lied to. They saw it as a major betrayal.
So a feeling of broken promises.
Yeah, and accusations of hypocrisy and manipulation from the GOP. They were particularly angry about the timing, too.
The delay.
Yeah.
Pushing the major cuts past the 2026 midterms.
Right. They saw that as deliberate and cynical, a way to avoid immediate political heat.
Were there other concerns among those swing voters who opposed the bill?
Yes, a lot of talk about equity. About half of them expressed fears it would harm the poorest Americans, maybe even people they knew, family, friends, neighbors.
Connecting it directly to potential harm in their communities.
Some even explicitly linked future Medicaid cuts to rising death rates, echoing those academic studies.
And what about the swing voters who supported the cuts? What was their focus?
Their comments often centered on a belief or maybe a perception that undocumented immigrants are benefiting unfairly from Medicaid.
Ah, the fraud and fairness angle again.
Right. They saw the cuts as a way to stop fraud and restore fairness.
But is that accurate? Are undocumented immigrants eligible for Medicaid?
Generally, no. KFF, the Kaiser Family Foundation, a big health policy research group, they state clearly that undocumented immigrants are not eligible for regular Medicaid.
Though hospitals do get reimbursed for emergency care, right? Regardless of status.
Correct. Emergency care is different. But for the main program, they're not eligible. So that focus among supporters seems based on, perhaps, misinformation.
Okay, so that's the public opinion landscape complex, sensitive to framing, with strong feelings on both sides, especially around fairness and promises. Let's shift to the purely political side. How is this playing out within the parties and strategically?
Well, President Trump's own stance is a big factor. As we mentioned, he campaigned repeatedly pledging not to touch Medicaid.
But now seems to have endorsed this House plan.
It appears so, yes.
Yeah.
And that shift, as the swing voter analysis showed, is definitely creating that feeling of betrayal among some.
And it's not just voters feeling uneasy, right? There's pushback from within the Republican Party itself.
Absolutely. Very real divisions. You had about a dozen House Republicans, mostly from competitive districts.
People like Don Bacon, David Valadao.
Right. They actually sent a letter to GOP leadership. Pretty explicit.
What did it say?
They said they would not support a reconciliation bill that included any reduction in Medicaid coverage for vulnerable populations.
Even while supporting other reforms.
Yeah, they were careful to say they still support efforts to improve program integrity, reduce waste, fraud, abuse, standard lines, but no cuts to coverage for the vulnerable.
And in the Senate, any dissenters there?
Yep. Senator Susan Collins from Maine, she voted against the bill.
Citing similar concerns.
Exactly. Worries about the impact on low-income families and especially on rural health care, which is a huge issue in Maine.
So clear pockets of resistance within the GOP. And then there's that timing issue again.
The delay tactic. Pushing the main cuts to 2027 after the 2026 midterms.
Which everyone seems to agree is strategic.
Oh, yeah. It's widely viewed as a way to try and dodge the immediate political consequences. Get the tax cuts extended now, deal with the potentially unpopular spending cuts later.
So how are Republicans calculating the political risk here? Is the thinking that voters just won't notice or won't care by 2027?
That seems to be part of the calculus, at least for some. Mitch McConnell's reported view that voters will essentially get over.
Right.
It kind of reflects that.
What's the basis for that belief?
Well, there's a Republican theory that voters don't usually punish the party in power too severely beyond the typical midterm losses, especially if the opposition party is seen as unpopular.
And they look at past events.
Right. They might point to situations where attempts to repeal Obamacare didn't lead to electoral wipeouts, or where the first-term tax cuts didn't provoke massive backlash. Kind of a belief in political amnesia, maybe.
But is there a counter-argument? Could this time be different?
Many observers think so, yes. The argument is that healthcare cuts are different. They're deeply personal.
Unlike maybe more abstract tax policy changes.
Exactly. Losing healthcare coverage or seeing your local hospital cut services, that hits home in a way other policies might not. It could provoke a much stronger backlash.
And could the effects start before 2027, even if the cuts aren't officially implemented yet?
That's a major concern being raised. The idea that rural hospitals, long-term care facilities, facing the prospect of huge funding cuts in 2027 might start making changes now.
Like layoffs,
Mhm.
service reductions, preventative measures.
Precisely. So the tangible negative impacts could start filtering down into communities much sooner than the official date, creating political problems well before 2027.
Are we seeing any signs of potential electoral fallout already?
There's some early chatter. For instance, Tom Tillis, the Republican senator from North Carolina, decided not to run for
And
re-election.
some are linking that to this issue.
Yeah, some speculation connects it to potentially unfavorable polling numbers, perhaps tied to voter reaction to these planned cuts. It's speculative, but it's out there.
Any other potential ripple effects being discussed?
There's talk about state-level politics.
Hmm.
Could Republican-led states that heavily rely on Medicaid funding actually face a risk of flipping blue? If these federal cuts hit hard, it raises the stakes for state budgets and elections, too.
It really all seems to come down to whether people connect the dots, doesn't it?
That seems to be the crux of it, what many are calling the information bubble.
Needing.
Will voters, especially maybe lower information voters, see negative changes in their healthcare or community and connect it back to this specific bill and the party that passed it?
Or will other narratives take hold?
Exactly. Will narratives pushed by, say, right-wing media succeed in blaming Democrats or inflation or something else entirely? It really hinges on who controls the story and whether personal experience cuts through the political spin.
Okay, wow. We've covered a lot of ground here. We've gone deep into this one big, beautiful bill act, looking at the Medicaid changes specifically.
Yeah, exploring the bill itself, those really starkly different predictions about what happens next.
And the whole complex, sometimes confusing world of public opinion and political strategy around it.
And you've heard how polls can genuinely tell different stories based just on how a question is phrased.
And how personal this issue is. Healthcare access, Medicaid, it touches millions, including, as we saw, many people within the political base that's actually pushing for these changes.
Which is such a key dynamic here. And remember, this isn't just some abstract legislative fight in D.C.
No, absolutely not. This is a direct conversation about a program that serves, what, 72 million Americans?
Yeah, it covers over 40% of all births in the country, nearly two-thirds of nursing home stays. It's massive.
So the decisions being made right now could really reshape access to care, especially for vulnerable groups.
Right. It could impact whether your local rural hospital stays open, and ultimately it affects the health, the financial stability of communities all across the country.
So thinking about the long game here,
Yeah.
what's the final thought to leave people with?
Well, think about that timing again. The biggest impacts, the deepest cuts, they're delayed until after the next midterm.
Like 2027.
So the big question is, will the voters who told pollsters they were concerned, will those swing voters who felt betrayed, will they actually feel those consequences down the line? And crucially, will they connect those effects back to these policies made today?
Or will something else have captured their attention by then? And in this age of, intense political narratives and sometimes shifting realities, what does it actually take? What does it take for someone's personal experience with something as fundamental as healthcare to cut through partisan loyalty and really change their political calculus?
That's the multi-billion-dollar question, isn't it?